Can you talk to us about some of the mental health effects that have been happening since the pandemic has started?
I think one of the biggest impacts of the pandemic that started is the idea now that mental health exists. I think the pandemic has given that back as a bit of a gift to really highlight that we all have challenges. Now the other side of the coin is with the pandemic, we're isolated, and if you weren't isolating yourself before, because some people like to be on their own and you have to isolate now, I think it's really triggering a lot more mental health issues in our communities. And I think also, you know, we're breaking it down into like you have to be in this bubble and this is your bubble and that's it. And I think the biggest challenge with that, specifically with our adolescents and young adults, they're really socializing, even the little kids. One of the things I can say, my husband teaches kindergarten to grade 8, and he said like the kids are good, they keep their space, they keep their mask on. I think it's the adults that are having the biggest difficulties following through on mask wearing and all of those other concepts. The pandemic has really impacted us as a people. I think that, you know, we're living through a very historical time, but also in terms of, you know, reach out for help. You know, one of the things they used to do a long time ago is pick up a phone, dial the numbers and, you know, call someone. Well, everybody's so into their devices right now. One of the challenges about that device, you know, is getting all that really tough information, and people will watch the news or they'll look at that tough information. Another piece that really impacts people's mental health is our social networking. People are sharing fake news and it looks real, and you know, some of the social networks are really getting cracked down on that, but if someone with pre-existing potential depression, anxiety, self-esteem issues, and they look to the pandemic and the results of, we have so many cases today, and if you watch it every day for 5 days, let's say, and you gauge your mood, at the end of the week, you're gonna have a really tough mood of like maybe a 2, 3 out of 10. When had you not watched those news programs every night about that, you'd be at maybe a 7 out of 10. We have to really get to this place in terms of mental health about taking this time and really embracing it as something we can do for ourselves. Working, you know, one of the things, another thing the pandemic has created is us being with our families. I mean, I can say I've never been home so much in my whole entire career. I became a mom really young at 16, and to today, I have never spent this much time at home. But one of the things that we could do while we're in our homes is really reflect on what we can do for ourselves. You know, take a mindful minute, do meditation. There's tons of free apps out there. Physical activity really increases our endorphins, gets us active. 5 to 10 minutes of exercise per day helps us with that feel-good hormone, makes us feel better. It improves our mood, getting good sleep, getting good food in. All of the basics, like our human basics that we need, is really important in time of the pandemic. Because if we don't take care of ourselves that way, our mental health issues increase, and we start relying on sometimes substances to really replace that. And what I'd really like to suggest to people is just take that mindful minute. Take care of yourself. People don't realize that, you know, take a self-care days. Take a whole day for yourself to do something for you. Do it as a family, you know, have activities in the home that make you feel good about yourself. We can't really control what's happening in the universe right now, and it's something we've never seen before. But if you could take that time for yourself to really challenge how we're feeling isolated, we're feeling on our own, we have to wear masks all the time, we have to wash our hands all the time. You know, all those things are the way that we live now. It's our normal. So hopefully, you know, one of the things that I can give back to as advice to our communities is to really connect with others. Check in on people. You know, before we used to see people, now I'd say check in on people. Send a text out of the blue and say, hey, I really miss seeing you. You know, when you're thinking of someone, pick up that phone, call them, FaceTime. We really need human interaction, and as human beings, we need touch. And psychologists for years have really identified that idea of touch, holding. Well, right now we can't do those things, so try to reach out to help build a stronger sense of community. If we can get through this, that's the way we can, is helping each other get through this.
Thank you.